Please subscribe and don't forget to press the bell icon to get notified whenever we upload a new video.
Well, come the 15th of August, and the Prime Minister may make a note of the Ayushman Bharat scheme during his address to the nation from the ramparts of the Red Fort. Popularly known as NaMo Care, the scheme has been touted as one of the government's big-ticket reforms. The Ayushman Bharat scheme aims to guarantee a health cover of 5 lakh rupees to 10 crore poor and vulnerable families in India. With more than 1,000 treatment packages under its ambit, an estimated 50 crore people expected to benefit from the scheme. The Prime Minister is keeping an eye on the rollout as well, but there are challenges ahead. First up, the Indian Medical Association had expressed its disappointment with the package rates offered under the Ayushman Bharat scheme. They were hoping for a review. They believe that the low rates are unacceptable and would put patients at risk as the quality of treatment would be compromised. The Niti Aayog, we learn, has now stepped in to mediate between the IMA and the Ayushman Bharat mission. That's not all. Most states have agreed to come on board. They will have to face challenges on execution. Moreover, subsuming individual state schemes with the Ayushman Bharat scheme is bound to have its own set of administrative hiccups. Joining us now to discuss this and give us a status check of this mega health insurance scheme is Mr. Indu Bhushan, the CEO of Ayushman Bharat. Mr. Bhushan, as always, thanks very much for joining us here on CNBC TV 18. Let me start by asking you for a status check, sir. The Prime Minister held a review meeting with you and your colleagues on the implementation preparedness of the Ayushman Bharat program. Are you ready for rollout?
Yes, we are. And you're right, Honorable Prime Minister had this review meeting last week on Saturday, and he went through the whole process, preparation process, what we've done so far, and we are ready for rollout whenever we are told to.
Okay. The assumption is that this will be rolled out on the 2nd of October. Is that the date that you're working with? And what can we expect perhaps on the 15th of August from the Prime Minister, specifically on the Ayushman Bharat?
Well, we've not been given a date, and we will go with whatever we are told. And we are getting ready for the rollout. And we are putting all the elements of the scheme in place, and as and when we are giving the marching orders, we'll be ready.
Okay, so speaking of the elements of the scheme, sir, what is the final update on the number of states that have come on board? I was given to understand that about 8 states have not signed up for the scheme so far. The rest have. Can you give us a status check on the states who are now on board? And what is the mechanism? Because the last conversation that you and I had, you said that the states would be given some degree of flexibility in designing the scheme. Where do things stand now in your negotiations with state governments?
Yes, you're right. 28 states are on board right now, and 8 states which have not signed up yet. Many of them actually are on the verge of signing, and there are states which where the necessary approvals have been done, and it's a question of just going ahead and signing the MOU. For example, Maharashtra, the cabinet had approved this, I think, on Monday, and we'll be signing the MOU with them soon. And other states are also almost ready to sign. And also, you're right that we'll be providing a lot of flexibility to states, because different states are at different stages of implementation, or they have different capacity and context in terms of health care seeking behavior. So we have to provide that kind of flexibility, and we are doing that.
Okay. When you say that you have to provide that kind of flexibility, can you give me specifics? Because we know that this scheme was designed in a 60-40 ratio with the centre and the states. But in terms of the specific areas where state governments will be given the flexibility to take decisions, can you give me specifics, sir?
Yes. So if you look at our states, there are some states like UP, Bihar, Haryana, they don't have any schemes. So in that sense, they're starting from greenfield, and where we can actually dictate that, okay, you have to have this framework, same framework, and from scratch, I think it's easy to establish a scheme. But in some states, for example, Rajasthan, Maharashtra, or many of the southern states, they have ongoing schemes. and the number of people they're covering may be different as compared to what we are proposing to cover. So we need to work out how the coverage will take place, and in terms of benefit packages, they may have more or less benefit packages as compared to what we are proposing. So while we can mandate that they'll have at least these benefit packages that we are proposing, they may like to add something more on that. And also the third element is about the cost. They may have some cost which is much bigger than our cost, and we'll have to allow that.
Okay, so you will have to allow some flexibility to states on what they might want to add by way of packages as well as on the cost front. But on the costs, you know, the IMA had raised objections saying that the prices, the rates announced were not viable. Have negotiations, conversations, has a dialogue happened with the IMA? Is there any change, any rethink on the package rates?
Absolutely. Actually, we've had this long discussions with IMA, not only IMA, but also other bodies or other professional bodies. We've been having this discussion, and we've taken their feedback actually quite seriously. And we have also explained to them that these rates are flexible. These are the median rates, and for a national scheme like this, we really can't have rates which will be fixed for all states. So for some states, of course, those rates are too high, and for some states they are too low. And we've given that flexibility again to states to change those rates, and that is what is happening right now. And we had extremely congenial discussion with the IMA, and we have had we've signed sort of a MOU with them, which specify that we will be going ahead. Yes, go ahead.
What are the contours of this MOU that you've signed with the IMA, sir? And also you said that again states will have the flexibility even on the package rates. Is there a price band? Is there a ceiling cap? Is there a ceiling or a cap when it comes to states being able to move up prices?
That's correct. They can reduce the prices as much as they want, but they can increase it by maximum of 10%. So that is the cap that we've given them. But in cases where they have ongoing schemes, and if the schemes, in those schemes, the rates are much higher than 10%, they can match those rates.
Okay. Now, as far as private sector participation is concerned, sir, you know, to get the private insurance companies on board, where do things stand on that front?
So private sector is, of course, extremely critical for our scheme. So they're critical for healthcare provider, private sector, and we are seeing tremendous response in terms of empanelment of hospitals. We opened this portal for allowing hospitals to empanel, and we have more than 7,400 applications already in place. Now, in terms of insurance companies, of course, we want their active participation, but you should note that most of our states are not going for insurance mode, they are going for trust mode. Out of 28 states which we have on board, there are only 6 states which are going for insurance, and some others which are going for mixed mode. So, of course, we've had very active participation from insurance companies in those states where we are going for insurance mode.
Is this what you would have preferred, that people take the trust route as opposed to bringing the private sector insurance companies on board?
Well, both trust mode and insurance mode have pluses and minuses. And if you look at health insurance schemes all over the world, in most cases, it is through trust mode. So I don't think it's necessarily a bad thing to go through trust mode, but at the same time, we also need to see if the states have the capacity to implement the scheme through trust mode, and that's where we are focusing a lot of attention right now.
Okay. On the tech back end, sir, because again, in the last conversation that we had, you said that, you know, the public consultation on the tech back end was under process. Where do things now stand on that front?
I didn't get that question. Can you repeat that, please?
On the technology front, sir, and whether the back end from a technology perspective is ready now for the rollout.
Oh, yes, absolutely. We've been actually working on this, the IT backbone of the scheme, and we have three core elements of the IT backbone ready. One is to identify beneficiaries, other one is for hospital empanelment, and third one is to process claims. And that third one is extremely important because it goes from when the patient is admitted to the patient is released and the claim is raised. And for all three, we have been now sharing with all the states who are ready for rollout, and we are undertaking training of people who are going to be operating these software. So in terms of having the first cut of this software, we are ready. We are testing it. We are right now doing the security testing and load testing, and we should be ready in a couple of days.
Okay, you'll be ready in a couple of days. In terms of the wellness centers, because that is also a crucial pillar as far as the Ayushman Bharat scheme is concerned, where do things stand on that front in terms of being able to add capacity as well?
I think we have, we made good progress on that front as well. More than 20,000 wellness centers have been approved, and I don't have exact numbers, but my sense is that about 5,000 wellness centers are in operations right now, and we aim to have large number of them operational by the end of this year. And you are absolutely right that that is a critical part of Ayushman Bharat, and unless that part of health and wellness center starts to work, the other part, which is health protection scheme, will not be that effective.
My final question to you, sir, before I let you go, because you pointed out for us that most states, with the exception of 6, have decided to go in for the trust mode. Can you explain to us how this is going to work exactly?
Well, trust mode is similar to, say, insurance mode. Only difference is that it's not only difference, it's a big difference, that instead of insurance company paying the claims, it will be a trust or the government itself that will be paying those claims. Now, for that, governments have to have the capacity to, first of all, look at the pre-authorization of all the claims which are coming to them. They have to make the payments, and they also have to have checks and balances so that they can avoid or prevent fraud and abuse. All these things were earlier being done by insurance agencies.
Does that mean that insurance agencies were not interested, and which is why the government has been forced to take this route?
No, no, absolutely not. Absolutely not. I think insurance agencies probably are disappointed that they're not getting this business. And because
so then why the decision?
I told you that we
why
have
the
6
decision
states
then to
where
go
we
the
do
trust
have
route, sir?
Insurance mode. And well, there are many reasons. One reason was that we have some states where we have long-standing trust, like Telangana and AP, and the experience of those states actually has been extremely positive. And many of our states have got inspired by those, and they thought that it will be good to follow that. Second was that maybe there was some distrust on the side of the government on insurance companies, and they wanted to not rely on insurance companies, and maybe the perception that we are paying benefits and margin to insurance companies, and that should actually go towards paying the actual beneficiary. And so maybe that was that is behind this change from insurance to trust mode in many states.
But But was this a change of heart at the center, or is this the problem that you're facing with states? Where does the trust deficit lie? Is the center wary of getting private sector insurance companies on board? Are state governments wary?
Well, we are not dictating this move. We have given this option to states. And now states have decided to go for trust. And many of them actually have gone through a lot of discussion and thinking. So there has been a lot of thinking behind this move. And luckily, we have some states who followed the insurance mode. We have some states who followed mixed mode and some states on the trust mode. So in a year's time, we should have some database to see which one works the best.
All right, Mr. Bhushan, appreciate you joining us here on CNBC TV 18 to give us a status check. That's an important takeaway there coming in from the CEO of the Ayushman Bharat program. 28 states on board, but most states have decided to go in for the trust mode, which means that private sector insurance companies, and this was the big opportunity that was being spoken of, have been left out of the execution and implementation of this scheme. Thanks very much for joining us here with your time. We'll take a break, but don't go anywhere. Big development in the Fortis versus Daiichi matter, that and more when we return.